Hi, I'm Dr. Liliana Bustamante. I'm one of the medical oncologists working at Florida Cancer Specialists in Lee County. I've been here since 2017 and I came from Tampa, Florida. I'm boarded in both hematology and medical oncology. Since I was in med school, I knew that I wanted to sort of do adult medicine, and that's kind of where it ended. I didn't know specifically what area. And then I did a rotation, was a med student in an oncology unit, and it was like love at first sight for me. I think it was I always viewed medicine as almost like a calling, and then it felt to me that this is a field that needs a lot of love and a lot of care, and I love the relationships that physicians form with their patients. I love the relationships that physicians form with their families. I think for me, oncology is like the perfect marriage of science and heart, I guess. I think because of this long relationships we form with patients, you meet them at a very intense and scary time in their lives, and you become kind of like their cheerleader and their coach, and I don't know, their helper. Sometimes they tell you things they don't tell anybody else. We talk about fears, we talk about, when this happens, I'm gonna be there for you. I think that if I always say this, and it's honestly truth, if I'm gonna be away from my family, if I'm gonna be doing something for work, I want to do something that has a lot of meaning. And for me, this has a lot of meaning. I feel like I have a purpose, and my interactions with patients sort of kind of fill my heart, fill my tank, I guess, how you'll say, so that it makes my work worthwhile, I guess. I think the most important thing is that I really, truly care about my patients. Since the moment they become my patients, I become invested in their life and in their future and in their care. So I try my very best with each and every patient. Everybody's different, and everybody's approach to their cancer and their diagnosis and their treatment is a little different, and I try to meet patients where they're at. And because I care, I investigate and I read and I go to conferences and I do tumor boards, and I try to do everything that I can so that I can be the best doctor that patient needs in that moment. So I think if I had to sum me up, is that I am a very caring individual, and I care for my patients deeply. I form very nice relationships with them and try to be there for them no matter what, whether we're having success or whether we're not. I think that probably is the best description of me.